pastor, leader, father, advocate. That's how people describe Bruce Williams, the pastor of Bates Memorial Baptist Church in Smoketown. In 2020, while the community was grappling with the pandemic and social unrest, Pastor Williams was grappling with a serious health crisis.
I was going just for my regular checkup with my doctor, Dr. Handel Jones, and he was examining my heart, and he said, I noticed, something sounds kind of off. No, I don't think there's anything to be concerned about, but let me do some tests.
This started a life-changing journey. After some follow-up tests, Pastor Williams was sent to Dr. Kelly McCants, the Executive Medical Director of Norton Heart and Vascular Institute Advanced Heart Failure and Recovery Program. Dr. McCants is also a member of his congregation and a personal friend who delivered some startling news.
He was explaining to me that I'm in mild heart failure. Not knowing the nature of the illness or the condition, I'm thinking he's going to tell me either, you're going to have a heart transplant, or this is how much time you have left.
Pastor Williams had been living with high blood pressure. Though he didn't notice it, it was doing damage to his heart.
So for a pastor and many like him, when you have high blood pressure for years, the heart muscle becomes weak. And if you don't take the right prescribed medications to reverse that, it can be pretty dramatic. By giving him the right medicines that he took in a compliant way, his heart recovered. Initially, his heart muscle was weak down into the 30% range. On good medical therapy, it came back to a normal range of 55%.
Dr. McCants diagnosed Pastor Williams with cardiomyopathy, a condition that causes damage to the heart muscle. But the diagnosis came with a bright side. Pastor Williams was able to get treatment, and this unique treatment would stop the damage and even rebuild some of the heart muscle.
So hypertension is challenging, right? Because the majority of people don't have symptoms. And so when we're saying early detection, how can you detect something if you don't have symptoms? If you have a family history, or if you're African American and you're over the age of 30, then you should be checking your blood pressure at least a couple times a year, seeing what those numbers are, because you're in extremely high risk of developing high blood pressure.
Although Pastor Williams was surprised by his diagnosis, he was willing and ready to make lifestyle changes because of his faith in God and trust in his friend Dr. McCants.
Ultimately, in my mind, and my health is in God's hands. But it's good to know I've got a physician who has the same kind of faith that I have, and who is a healer. And plus, knowing him personally and knowing that he takes his profession seriously, and that he operates at such a high level, was really comforting as well.
Today, Pastor Williams takes medicine, exercises, and tries to turn his stress level down. He hopes that by sharing his story, he can save someone else.
And let it just be the habit. Regardless of how you feel, go see a doctor. Every year, go see a doctor. Especially black men, African Americans in general, but certainly black men, you need to go. Pay attention to your body. If your body is telling you something ain't right, stop ignoring it. It is because you want to make sure that you catch what it is and address what it is, and you'll be glad you did.
On a day in my clinic, I may see 30 people. On a day at his clinic, in the pulpit, he may be able to touch 1,000. And so by taking care of the pastor, having him be that ambassador for hypertension and heart failure, he can touch thousands. It will take me a lot of clinic days to touch 1,000.